I turn to the member from Scarborough-Guildwood.
Thank you, Mr. Speaker. Of course, it is always a pleasure to rise in the House and to speak on behalf of my constituents in Scarborough-Guildwood and to debate this very important bill, Bill 269. I would note that it is a thin and meagre bill, not very in keeping with the times that we are in. We are in a generational crisis when it comes to COVID-19 and when it comes to the recovery needed for our economy to recover and to thrive, Mr. Speaker. So I would have expected that the government would have really met this moment. And I was looking forward to seeing what was in this budget because I know the issues that are faced and I know that this government has heard from people on all sides about what is needed. Speaker, this bill falls short. The measures contained in Bill 269 have not addressed the most pressing needs, such as paid sick leave, transformation of long-term care, or a green recovery. Speaker, despite the fact that women in this province have been the most impacted in terms of job losses, as well as the increase in workload at home, this budget has nothing meaningful for this session. This budget does not solve the challenges that we face. It does not clear the backlog in surgeries that are piling up. It does not close the learning gap for students given the rough year that they have had in school. And it does not transform long-term care, despite the government's promise. It is disappointing and it leaves many people behind. People feel abandoned. People with disabilities, children with autism and their families, nonprofits who are struggling to provide service with fewer resources, those who care about the environment, small businesses in need of liquidity and cash flow, those on the front line of care and essential workers who have not had paid sick leave to rely on, but despite that, they are the heroes of the pandemic. This government had an opportunity to implement bold changes in this budget, but it missed it. The government could have set a vision for a green recovery, making investments that would substantially improve the environment and protect what we all share, our planet. The government could have made clear that it was going to achieve its climate targets, that the government clearly is not on the path to do. This PC government's record on the environment is failure after failure. Cancelling Ontario's successful cap-and-trade program, which was a market-driven program, wiping out billions in revenue, earmarked for innovation for a green, carbon-neutral economy. Spending millions of dollars to fight a federal carbon tax in court that the Supreme Court of Canada has just, said that it's not valid. Spending $231 million to cancel green energy projects and jobs, ripping out electric vehicle charging stations, committing billions of dollars to Highway 413 when local councils right across the Golden Horseshoe oppose it. And as Liberals, we would cancel this project and instead invest in public education, something that we need in this province. And of course, repeatedly bypassing environmental protections through the abuse of MZOs, including really putting at risk environmentally protected lands in Duffin Creek in Durham. My riding of Scarborough-Guildwood is on the shores of Lake Ontario, and it's an environmentally sensitive area. We know that what flows downstream affects us. So whatever you do upstream, you've got to be mindful of that. The budget allots a mere $12 million to detect COVID in wastewater. Does this even go far enough? Does this meet the need and the risks that that poses to our population? Speaker, where there's been major oversight in this budget is that the government shamefully neglects Ontario's students, parents, and education workers across the board. When you look at the funding for public education, it is just 1% increase in funding, not enough to keep up just with inflation and natural growth. It is therefore a cut to public education. Before the pandemic, there were substantial educational gaps between marginalized and non-marginalized communities. And these gaps will continue to widen and be exacerbated unless there is a plan in place to address it. I have yet to hear the government speak about how they will close the learning gap post-pandemic. Speaker, we've talked a lot in this House. I've raised this time after time, the issue of the she session. And at the beginning of the month, Stats Canada's labour force survey was released, and to no surprise, Black, Indigenous, people of colour, as well as women and youth, are the most impacted by job losses in this country. The COVID-19 pandemic is having a disproportionate impact on women, with women's labour force participation rates falling to rates not seen in decades and well below the pre-pandemic levels. Shutdowns have most severely affected sectors like the service sector and those that are predominated by women. Restrictions on school and paid childcare facilities have shifted additional hours of unpaid family care onto parents, but especially mothers. And the pandemic has been especially challenging for already vulnerable female groups, including racialized, Indigenous, low-income, and single women. The province needs to focus on this problem because Ontario cannot recover and thrive economically after the pandemic unless we ensure that women have the necessary supports to thrive. And here are a few recommendations for the government. Having women at the decision-making table and making sure policies for recovery are applied in a gender way and a diverse way as well, Speaker. Enacting the pay transparency legislation that is on the books and just needs to be enacted. Making schools and classrooms safe for students and teachers to prevent the further spread of COVID-19 and outbreaks, and ensuring that families have access to affordable, high-quality childcare and early learning. Childcare is quickly being seen by most progressive governments as a part of the economy. This budget offers nothing for childcare despite the huge and overwhelming needs. And what has been put in place, Speaker, is temporary, does not go far enough. Speaker, I want to also address the concerns of youth in this province, because we know that last summer, youth unemployment was very high. They lost the opportunity for internships and summer employment. And now, under this government, we are seeing that financial aid that has been assigned to programs is not even reaching those students who are in need. The FAO cites that $473 million remains unspent in the student financial aid program under this government. I am calling on the Ford government to immediately invest this grant and this amount into grants and summer programs for youth so that they can start companies and that they can save money for their post-secondary education. Speaker, it's marginalized students that will be the most impacted and least able to foot the bill, and this could lead to long-term scarring effect post-pandemic. We've already spoken so much about paid sick leave in this House. I just want to reiterate that the medical officer of health, Dr. Eileen Davila in Toronto, along with the Board of Health and municipal mayors across the GTA, have called on the government to implement paid sick leave because they know that it will save lives. Why are you not heeding this call? And Speaker, healthcare is our largest budget item, and under this government, it is increasing by just 1%. It does not keep up with the rate of inflation nor the natural growth of our aging population. Neither does it cover those backlogs of surgeries and areas that we did not get to during the pandemic. So really, this government is reducing the quality of life of the people in Ontario by not spending adequately on health care. The government, we're in a third wave. You knew that a third wave was coming due to the variants of concern. Yet here we all are, Speaker. What about the investments in public health? The FAO cites in its third quarter report that you have underspent the public health budget. How is this possible, given the fact that you have downloaded responsibility for vaccination as well as testing to public health units, the 34 units across the province? If you had not cut public health when you first had your mandate in government a couple of years ago, we would have been further ahead today. But you did cut that public health budget. And I am calling on you, and I'm joined by a number of groups in this province, to ask you to reinstate all of the funding that you have cut to public health in this province. We all share in the need and the value of public health to all of our health. Speaker, long-term care is really the tragedy of this pandemic. We've just seen reports today that of all the wealthy countries in the world, we are the worst when it comes to our record on long-term care. That's shameful. And Speaker, in this budget, the government had an opportunity to protect our most vulnerable. And once again, they missed it. No 4 hours of dedicated care, no meaningful increase in personnel into long-term care, and our most vulnerable seniors are kept waiting. As we look forward to our recovery, Speaker, there are areas that we must continue to invest in, like our small businesses. And today, I join with the CFIB and small businesses in my riding of Scarborough-Guildwood to call for the extension of the small business grant so that businesses that need it, and we should expand the criteria as well, can receive that grant. And I will be sharing my thoughts with the minister responsible for this grant. Speaker, when it comes to building our province and preparing Ontarians for the future, nothing is more important than investing in the health and in the well-being of the people of this province, including affordable housing, by the way, which your budget is completely silent on. So, Bill 269 does not reflect a bold vision, and it does not propel us to the generational change that we need. Thank you, Speaker.
Thank you.